fact that came up, same question, just to elaborate on that. I learned that up to 20% of youth who leave home, so 20% of all youth that leave home after coming out to family members who don't accept them. Does that stagger anybody else here today? I was shocked to hear that. 1 in 5 homeless youth are on the street because they came out to their parents and we didn't accept them for who they were.
I think personally, looking at, touching a little bit on like what Julio said also is that a lot of our minority communities, we focus on this assimilation of what it is to be American, what is accepted. I know that there is a growing acceptance of gender identity and sexuality in the culture of America right now. But unfortunately, I feel like the Black and Hispanic Latinx communities, we're just kind of like trailing behind. And we don't like to have these conversations. We operate on like a don't ask, don't tell kind of, if you remember that from the 90s.
Yeah.
And so the only way we're going to grow is to have these conversations, right? And so as we sit here and talk as people of color, we can talk about race. We can talk about race all day and it's comfortable. But we don't always like to talk about race with, white Americans because of that fear of making them feel uncomfortable. And so I think that's the same thing that goes with the community, like the LGBTQ community, is that sometimes these conversations can make other people uncomfortable. And so I think that's where we're lacking behind, especially in our racial and ethnic minority communities.
Yeah, I couldn't agree more. I think, would you agree with me, Aaron? It makes me uncomfortable to think about our youth of color out on the street. That makes me uncomfortable. So whatever we can do, whatever we need to talk about and do to make sure that doesn't happen, then I can live with that, because I think we got to get our kids off of the street. As we ready to wrap up, we could talk about this for a long time, guys. I'm sorry, did I cut you off, Aaron? Were you going to say something there?
I wanted to add something. I think that
please. Yeah.
One of the things that, like I keep hearing, like, decolonizing our mentalities, right? Like removing the culture of the oppressors. And sometimes it's kind of like a weird concept, because a lot of the cultures in the Latinx, in the indigenous, native, and Black communities originally had a different point of view in regards to LGBTQ people. And a lot of the oppression and a lot of the stigma came from the colonization, from the people who brought us here, whichever way we want to see it. But then now that there's a different approach in the general population, especially with the white communities, like looking at how they talk about gender and all that, we are having a very difficult time sometimes accepting that as well. They're trying to impose this, when in reality we were forced to have the colonized mentality about how we treated LGBTQ communities.
Wow. I don't even know how to come back from that. I see everybody nodding on that. I think you're right on the money, Julio. Absolutely. Absolutely. As we get ready to wrap up, we could spend the whole afternoon talking about these issues. As we get ready to wrap up, I'm wondering from all three of you, maybe, do you have any suggestions for someone who might be experiencing homelessness, even as they're taking a look at this video, especially males of color, as we are dealing with everything else that we deal with on a day-to-day, minute-to-minute, hour-to-hour basis? Any tips for folks who are experiencing homelessness? And generally, maybe as we wrap up, how can we as a society do better so that we can address this issue head on?
I think from a healthcare standpoint, I feel like whether you're an individual or you have a family member that's experiencing homelessness or mental health issues, to really just be an advocate. I know, like, we look at healthcare in general, and we don't always have the fairest outcomes for people of color. And so it's really important to have advocates for you. Exists implicit bias and things like that, where we don't always get as much as fair treatment. And there are lots of resources between nursing, social workers, case managers. It's there. And sometimes you have to dig a little harder as a person of color to get those resources.